we still want people to take care of themselves and be preventive with their care. And we do want them to exercise, and we do want them to meditate, and we do want them to, walk. But they generally have bigger problems first. And I tell employers, if they have a wellness program, we're going to fix your health plan first, and then we'll attack the wellness plan. By the way, you can just keep it. We'll keep it there. But we got to get your people squared away so that they can afford their preventive care. They can afford their primary care. They get the care they're supposed to have when they're supposed to have it. Don't hold off. Get the MRI, get the surgery, get the procedure, get all the stuff they're supposed to be doing. Now they're going to be the human that wants to do the wellness program.
Hello, everyone. Welcome to our podcast. I'm Sasha Grilov. I'm your host. I'm the co-founder of a company called Milu Health, and I'm joined today by Aaron Witwer, who's the president of Ben Engage and also the president of the Revolution Benefits Group. Aaron, welcome. Thank you for being here.
Absolutely. Thanks for having me.
How's your day going? What's up? How's the morning?
It's going great so far. I am looking forward to heading out to beautiful Puerto Rico soon, tomorrow, for the U-Powered Symposium. So there might be color on my face at that point.
I'm looking forward to it too. I've never been before. I'll be going a few days later, but I'm excited to check it out and meet some folks over there.
Yeah.
One of the things that we do on this podcast is meet folks who are building something different in the healthcare space and the health insurance space, and specifically focused on employer-sponsored healthcare, because the majority of healthcare in this country is provided by employers for their employees, and it's broken 55 different ways for patients, for doctors, for everyone in the ecosystem. So a passion of mine as we're building Milu is find folks who are doing something and bring them here and hear them talk about what they're doing and why. But before that, no one gets into this space with a lifelong plan. So I'd love to hear, how'd you get here?
Yeah, I started in healthcare. Actually, as a practitioner, my undergraduate was in kinesiology and sports healthcare. And then I got a master's degree also in sports healthcare and was treating patients on the field, like athletes on the field. First guy running out on the football field and basketball court and stuff like that. It was really fun. I was far more drawn to the lay population. So that got me into physical therapy, hands-on physical therapy as sort of a PT tech, working alongside physical therapists in that office, which was cool too. But what I realized was I was in the reactive side of healthcare in PT, like in rehab, we're at the end. People had gotten unhealthy far before that. And that took me on this journey, which has now been 15 plus years in corporate health, right? Preventive care. And so corporate health took me to the Cleveland Clinic, and I was there for a number of years, which was great. In the Wellness Institute there, working for some phenomenal folks. I learned a lot and got my first real exposure to an employee health plan. And the Cleveland Clinic has this monster self-funded health plan, 40,000 folks or so. And I started to get a little insight on how do you really manage care? How does this health plan contribute to people's health or not? And I had only seen that as a practitioner, right? People would come into the PT clinic and I only have 20 visits. We got to make the most of this, which was very frustrating too. And I hear clinicians say the same thing. And that's why we need to draw closer to direct care. But when I got that exposure, it made me really interested to start to look into what other people were doing from a health plan standpoint. How are we making really equitable health plans? And that just wasn't really out there. But that exposure got me recruited to a broker, which I was at for 7 years up until about 2019. And that really opened my eyes. That, as a corporate health guy coming in to the insurance world, learning about insurance and how health does or does not weave into those health plans was, mind-blowing would be an understatement. What are we doing here? This cannot be right. I just remember thinking no, I've got to do better. I have to do this. I have to do better. I have to keep pushing. And that's kind of what I did. And then in 2019, I decided I think I could do this better on my own. I'm going to keep going and do this on my own, partner with other advisors. And in one way or another, that's what I've been doing the last 4 years.
That's awesome. You don't often see folks who have seen as many different pieces of the puzzle as as you have, and as many different patient populations. Like I'm sure in PT and in wellness and at the clinic, you were seeing everyone under the sun, not just, a white collar employee or an athlete.
No, that's absolutely right. That's all of that has taken me upstream. Employers have this, phenomenal opportunity, for better or worse, to impact their employees' lives. Right, they're at the top of the food chain in terms of how people get their health care. Because in this country, most people get it through health insurance. They sort of like, I have an issue, I need to get to the doctor. There's a wall, and that's health insurance. And when we do it right, it's a really low speed bump, right? And that's really what I've been doing the last 4 years. But either way, you're sort of going through health insurance, and that's kind of a bear. And a lot of times it's total nonsense, and the wall is really high. So we've got to lower that and get insurance out of the way and make it much more about healthcare. So I've been able to see that from both sides and see how it's gone badly and see how it's going well. Some of my plans, some of my colleagues' plans and co-consultants' plans around the country. So it's nothing but energized me to keep going down this road. But if you had asked me even 10 years ago, would you be in health insurance? I would have, said, of course not. Why would I want to do that?
Right. It's not sexy outside looking in, and then you dig in and you kind of peel it back, and the opportunities to create something new are huge. So you're building something new at Ben Engage. Can you talk about that?
Yeah, I'd love to. What I essentially saw as we build these more equitable, ethically designed health plans, they aren't the smoothest health plans. We're not in this stack of the same company providing all of the aspects of a health plan. So if you go to United Healthcare and you buy a United Healthcare plan off the shelf, you're getting United Healthcare as the administrator, United Healthcare as the network, United Healthcare as the PBM, United Healthcare as the medical manager, United Healthcare as the diabetic management. Maybe they plugged in some other company, but essentially they own them all. They're all fairly integrated. Customer service is integrated. Well, when most of us in our sort of niche industry are building these rebundled health plans, right, more equitable, ethically designed, you kind of have to rebuild these plans like bits and pieces at a time. And you may only be using one or two aspects from the similar company. And so you have, a different administrator, a different network, maybe several networks, direct contracts, a different medical manager, a different PBM. You're plugging all these pieces in to rebuild a health plan. Customer service, it just becomes a little bumpy in between. And essentially what Ben Engage is for those advisors, those consultants out there building health plans from scratch to some extent, we can be the one-stop shop for the members. So just have your members call us or email us and we'll navigate them through the system. And oftentimes members are just confused. They just don't understand, like, why did I get this bill? Or what does this EOB mean? Or like, sheepishly, they'll be like, I don't really know what a coinsurance is. I signed up for this plan, but I actually don't really know what it is. And they can call us and we're not really, we're triaging to some extent, but most of the time we say, let me explain to you what's going on. This is why this pre-authorization is happening. Whatever it is, we're really just navigating them slowly and empathetically through the system so they get what they need. And at the same time, that helps the advisors, it helps the employers, the HR teams to say, call the concierge. Like, it's ours. They know us really well. Just call them. And it's been fun. We've been doing this for about 18 months. So it's been a blast trying to help these employers and these benefits advisors.
Correct me if I'm wrong, but I think you started this for yourself, right? You were an advisor. You were putting together these kinds of plans and you saw the gap.
Yeah. I've worked with a couple Health Rosetta advisors. I myself am a Health Rosetta benefits advisor, still have a book of business of my own, still have clients that come through. But most of my time now is spent with other advisors because I saw what it was like working, alongside Bryce Heinbaugh was the first guy, her first Health Rosetta advisor that hired me. Then I worked for David Contorno and Emma Fox. They are pioneers in a lot of ways. Both those gentlemen, Emma included. I saw how these plans were getting built. They're the best health plans, really. But they make the member experience can be a little clunky. And so both of them have actually kind of solved that problem in many ways, in different ways. But part of what Ben Engage is that solution. And especially with David Contorno, with the ePower Benefits that I was working with in 2021, especially, we sort of saw this happening 2021, 2022, sort of saying, like, we better get our arms around this. Otherwise, other advisors, younger advisors aren't going to want to adopt these health plans if they're difficult. So like the purpose of Engage is to say like, just, if they get bounced around in the system a little bit, or they're confused about a medical bill, or somebody asking them like, we don't take your health insurance plan, I don't know what this means. Just have them call us. We got it. We'll talk to your doctor. We'll call the health system, whatever. We got you. We'll explain it.
How has it played out so far? Like, what are some stories where you guys are actively engaging and seeing patient impact?
I've got hundreds of stories, like dozens that have happened this week. We've have probably, I don't know, thousands of employees that are sort of under our umbrella that we're trying to assist now. And they call in for, I could probably look at my inbox, our concierge inbox, the text messages people send in, and there's so many stories. One in particular, these kind of pop up all the time. One is about an MRI, and the woman was wanted to get this MRI. She had gone to a hospital system out in San Francisco who really does not like taking reference-based, like open-ended plans. Like they have these contracts and that's what they stick to and that's what they tell people. And she's trying to get this MRI at their facility. And on the health plan, it said like, you have to go off hospital. We're not going to pay $5,000 for this MRI that can cost us $400. And she was really frustrated at first and talked to us and said, wait, that's what they're doing? Like, that's why it's going to cost me and it's going to cost my health plan more money. And you're telling me the MRI is across the street? And, the concierge, yeah, absolutely. If you go there, it's no cost to you either. We're sorry for the disruption, of course, but we can get you over there today. And she's like, oh, that's fantastic. And what you see, that's a good example, because what we turned her into is a much better consumer in the industry. And now she knows like, oh, I don't want to get that at this hospital system. I want to get this across the street. I don't have to pay anything. My employer pays less. That affects my premiums down the road. And, part of our goal, sort of happenstance, is to educate people, make them better consumers, help them understand what's happening to them on these health insurance plans. We had another really great example where here locally in Cleveland, this member went to get an infusion and the hospital said, well, we don't take your insurance plan. We don't recognize it, whatever. It doesn't have some big old logo on it that we recognize. And we're going to make her pay like, I don't know, $20,000 up front or something like that. Put her on some sort of payment plan to get this infusion. And she, called the concierge. And the team said, don't do that. Of course, we'll try to get you there because we want you to get the infusion where you want it, the same drugs, right? We don't want to really disrupt your care. Ultimately, we got her to a different hospital system, the county hospital here in town, that she was happy to go to, same medication, everything. And it was, I don't know, $1,000 or something like that. So it was going to be like less than a tenth of the cost. She got what she wanted. The medication, we still communicated. She communicated back. That hospital communicated with the other hospital, which was her doctor that had ordered it. And everybody was happy. And I think she might have even had one since then. This was just 6 months ago. These options are out there. But if she didn't have the concierge team, I'm not sure how that goes. I'm kind of sure how that goes. That's probably gets bounced around and she's confused, or she just acquiesces and says, yeah, I need the medication if this is the only way to get it. But instead, she knew she had someone she could call. We just have so many of these kinds of stories where people start to be educated on the system and start to, frankly, want to stick a middle finger up to it. And they're like, I'm not doing, this is ridiculous. I'm being educated on how to use this system, but you're telling me I got to pay $20,000 up front, or I have to get this $5,000 MRI, or, this is silly. But there are some hoops to jump through, and not everybody likes that. But our job is to make those hoops as easy as possible, right? The speed bump I mentioned earlier, like really low and pretty smooth for them, so that they don't have to, eat these stupid health plans they're on right now and, pay out the wazoo.
That's awesome. And what are the profiles of employers that you're seeing this have the most impact on?
Blue collar, almost exclusively blue collar, because when you start to explain not only to the leadership, of course, in the leadership first, but once the leadership says, oh, absolutely, like my people are going to love this. Once you explain it to the membership, they start having the experiences, they start calling in, they're very appreciative of the $2,000, $3,000, $4,000, $5,000 you just saved them. And they understand. It takes a little while, right? It can take months. It can take a full year for the whole the whole company to start to understand why this plan feels different, but they overwhelmingly appreciate these types of plans. I say, I'm going to build you an equitable, ethical health plan. And if I can say that in 2 sentences and they perk up, then I know I got a good client, or I get a good prospect and the potential to get that client and have them be on board, because they haven't really heard that. And once I explain what that means and how I'm going to fight for them to build this plan the way they need it to, they're like, yeah, let's go. Let's do it. But if people are hemming and hawing, like, yeah, that sounds cute, but like, what's it going to cost me? How much is this going to be? I need to save some money. Like, this stupid Blue Cross renewal is killing me. Like, help me out here. I'm like, we might not be the right match here, because your folks might make $100,000 a year and not want to jump through a couple of hoops. They might not like the speed bump. And I mean, I'll help them the best I can, but our experience has been they those kind of folks don't want to be as disrupted. They're like, I don't care how much the insurance costs, just, hook me up with my Blue Cross plan and leave me alone.
Makes sense. And how do members find out about you? Is it a phone number that's on the card? Is it a lot of member education? Are there other things?
Most of the time we're able to get our phone number on the ID card. And so it's there's stuff on the ID card about us, and then about like the providers when they call in to get verification stuff. We hope there's more, maybe just 2 or 3 phone numbers and that's it. Otherwise the member gets confused. So yeah, just call us. So the one phone number is on there. We push a lot of text messages and a lot of emails to the members. Text message has gone way better than I thought it would. A year and a half ago, I was like, people don't want to be bothered. They don't want text messages. Now people love that. It becomes top of mind awareness. If we text them twice a month about little nuggets, they might not do anything with it. They might just see it on their phone and then put it away. But when they need it, they get that bill in the mail and they're like, wait a second, I think I get texts about
I got
this.
a text about that. Yeah.
That's it. Like, you guys get that too. And, we've had some fun conversations back and forth about that is really opened my eyes on like top of mind awareness and making sure we connect where people are. That's been a really big deal.
Well, it's huge, right? Like I've been in the world of Blue Cross plans and United plans, and you get emails and you get EOBs. But like, what % of people look at those? And that's not limited to Blue Cross and United. It's really anything. It's really hard. It's your hospital patient portal where you got to go into the thing and do some stuff. Whereas like, if you can directly reach out to someone, in our world, we're focused on doing it at the time that like we see that it matters most, but we think we could really start moving the needle. And you got to give them the thing that they need, right? It can't be some kind of bland, like, this is wellness month, right? Like that's great too, but that's not going to lead the person to like change the thing in their life that they really need to change with.
Wellness month is great. Yeah. They're like, well, what wellness? What? I'm trying to afford my bills every month. Like,
exactly.
I take 2 buses to work every day. Like, get out of here with wellness. That's what we were doing at the Wellness Institute at Cleveland Clinic. Like, there was some really gritty stuff and really valuable stuff we were doing. But at the same time, it was just this era where it was like, got to do wellness plans, got to do wellness programs, biometric screenings, all this stuff. My goodness. If they felt like they wanted to, right, I would have nurses walk up to us and be like, honey, I have a lot bigger problems than trying to walk 10,000 steps a day. All right. Get out of here with this.
Yep. And, I've read a few studies on wellness programs overall, and it looks like they don't really reduce cost in the long term or dramatically improve population health. So I think it's a big open question on like, there's a place for them, but you got to have limited expectations.
We still want people to take care of themselves and be preventive with their care. And we do want them to exercise, and we do want them to meditate, and we do want them to, walk, but they generally have bigger problems first. And I tell employers, if they have a wellness program, we're going to fix your health plan first, and then we'll attack the wellness plan. By the way, you can just keep it. We'll keep it there. But like, we got to get your people squared away so that they can afford their preventive care. They can afford their primary care. They get the care they're supposed to have when they're supposed to have it. Don't hold off. Get the MRI, get the surgery, get the procedure, get all the stuff they're supposed to be doing. Now they're going to be the human that wants to do the wellness program, that is in a good place to take care of themselves. And that's what the wellness program can spur, that can hold them accountable, can nudge them, can make it fun and interesting. Before that, you got to get people to square one, which is why I use this equitable, right? Health equity. We've got to knock some of these drivers, these social determinants down for folks so they have fewer barriers to be able to take care of themselves. And we got a ways to go.
When you look at employers who are thinking about the types of plans that you typically work with, these community-based plans that are put together with a lot of different solutions, like what's going through the employer's mind? Like, what's the decision that they're making? Is it, am I going to dramatically increase deductibles because my premium's through the roof? Is it, hey, I'm okay now and this is just another option? Like, put me in the employer's mind as they're thinking about some of these decisions.
I would say that oftentimes it is about money first, or they have heard me talk about an equitable and ethically designed health plan, and they're like, yeah, that's what we need. Like, I get it. I talked about this before. They're probably a paternalistic employer. Maybe they're family owned, and they're like, well, I know we're getting screwed. I don't know how we're getting screwed, but we're getting screwed. Like, this sounds right. Or they come and say, like, I'm just getting hammered from a cost standpoint. I don't know what else to do. I heard about you, or somebody mentioned you, or I saw you on LinkedIn or something like that. And I say, great, I can definitely save you money. Hands down, categorically, 20% probably out of the gate year one. However, you might not like it. So let me tell you what this is going to feel like, and then you decide if you want to do that or not. And certainly not all employers do it. I've had plenty that you go down the road and they're like, I think I'm just going to take my Blue Cross renewal. It's only 6% or whatever. I'm like, okay, that's fine, because you're probably not the right fit. It's not painful enough. We're not connecting enough on what kind of plan you could have, and you don't need it bad enough yet. Or you don't see the light.
And where do you think this space goes? Like, do you think in 10 years, like, every employer in the country is thinking about this kind of stuff? Do you think every blue collar employer in the country is thinking about this kind of stuff? And where do you think the gaps will be? Like, what needs to be solved?
Yeah, probably not. I mean, we all sort of feel like this thing is moving pretty fast and it's getting a lot of traction. And, I'll talk at this conference next week to a bunch of my advisor friends who have all these success stories. But when you really break it down, you're talking about these are hundreds of employers in this country that are doing this. That's not even close. So in 10 years, no, we probably we won't have as much as I would like us to, but we'll have a lot more examples. And I think the tipping point will be transparency will be part of this. So the more we push transparency, the more that consumers demand to understand the cost and like why the cost is, employers will have to ask. And they will be calling me more and calling their traditional broker less. Because they're like, this doesn't feel right. And you seem really transparent. You're telling me about how you make your money, and it's a PEPM, and you don't take these commissions. And like, this just seems like how I probably should buy it. And I'll say yes. And hopefully what's happened actually in these next 10 years is that the industry starts to see that I'm getting more business and the traditional brokers aren't, and the traditional brokers change the way they do their work. And now they're bringing it to these employers and saying, you know what, I have this new thing. This is going to be a better kind of health plan. But we've got a ways to go, because the carriers are who pay the brokers, and the carriers definitely do not have an incentive to change. So these traditional brokers need to throw the middle finger up to these, carriers and be like, I'm going to go build it better. I'm going to do it myself. I'm going to help my community in Cleveland or my community in Chicago or Austin or wherever, and just get it right. The hospitals are on board. The clinicians are on board for the most part. Like, they're in. Like, I know, I talk to clinicians all the time. They have no idea anything about health insurance. They're in. If we can get all the advisors, all the employers, and the clinicians on the board, right? The doctors, the PTs, the nurses, everyone would be like, yeah, let's do it. But you get traditional brokers and insurance carriers in the way, and hospital administrators in the way of this stuff happening the way it's supposed to happen. But luckily they don't drive the ship, right? So like, luckily we've got them. We just got to get them educated. So there'll be a huge movement. And if you talk to a Fortune 100 company, Fortune 500 company, they're like, yeah, of course you should be self-funded and you should do all these things and carve out your PBM. They're already doing this stuff. Maybe not even as aggressively as I do it, but they're doing it. That stuff just doesn't always trickle down. And last part of this is, like, I talk to small employers. Sometimes I'll tell them, well, this is what larger employers are doing. But I've come to learn that doesn't always click with them. And they're like, yeah, of course they do. but that's not me. So more stories about how large employers are doing it, more stories about how my clients are doing it should attract more brokers to want to do it and more employers to call me. And then we'll build sort of this snowball rolling down the hill effect. That's what I'm really hoping for, but it is going to take the leaders of these spaces, the doctors, the clinicians, the employers to say, we got this, we can do it.
That's awesome. Do you see different parts of the country responding to it in different ways? Like, are there geographic differences that you see with clients in Cleveland versus with clients in other places that matter, or is it pretty similar?
I have clients in a lot of states and a lot around the country, a couple clients that are just really, really spread out. So I've gotten to experience a lot of, I mentioned San Francisco, New York City, Houston, Dallas, Chicago, Kansas City, like all over in between. I don't see a whole lot of difference. There are differences and there's pockets. The one hang up can be hospital systems. It can be large hospital systems who claim to be nonprofit, but they are not transparent with how they do their work and their pricing. And that is holding back the adoption of some of these unbundled plans, open access plans, bundled surgical case rates and stuff. By the way, that jumbo employers demand. Like, they're not going to Cleveland Clinic and paying Cleveland Clinic prices. They're going, we will send you 10,000 employees this year for knee replacements, but we're only going to pay this much. And the clinic's fine with that. They make these deals happily. Like, well, let us tap into it. Which, to some extent you can, but you have to know how to do it. So some of those hospital systems can hold back progress, but otherwise it's not geographically bound too much. But again, I know some of these areas really, really well, and others I don't know as well. But I don't know an area of this country where there's not a health Rosetta advisor that's getting some inroads. I don't think there's a state that can't do it or an area that cannot do it. They just might have some of their own challenges.
It's funny what you mentioned about the clinic. And I've seen a bunch of their stuff too. They put out a lot of great content. Like, they've got great webinars and they have relationships. I think there's a case study from like 10 years ago of them with Walmart and other big hospitals. It's fascinating, right? The biggest employers have built some awesome programs. They'll fly you out for your surgery.
Yes.
It's an amazing experience. And it makes you think, like, shouldn't that be the case for most stuff? Like, shouldn't I go somewhere and, I don't know what it's going to cost, swipe a card. That's
Absolutely.
what it costs,
I mean, the centers of excellence thing is like a really big deal. Like, I want to send every member who has something very serious going on, right? Back, joints, cancer, transplants. They need to go to a centers of excellence. And there are these all over this country, which we are very blessed to have at institutions like the Cleveland Clinic, Northwestern, NYU Presbyterian, Mayo. These are beautiful institutions. Like, we need to be able to tap in the same way. A small employer should be able to tap into those the same way like larger employers do. And that's not quite happening, but that is kind of what Health Rosetta advisors, that's how I build my plans. It's just harder to do as a small employer. You don't have the same impact. Tapping in can be more difficult. That isn't necessarily the problem. It's the tapping in, making the plan work really well. But like not paying off the shelf Cleveland Clinic and Northwestern and Mayo Clinic prices like that. They can't afford it. Small employers can't afford that. That's
but by the way, I assume, I could be wrong here, but I assume the cash prices at these places, the small employer could afford.
Yeah,
because they're going to be less than the price they're going to have at their local community place, even with travel included.
For sure. Absolutely. And it's where you want the care. They say that all the time. Well, I really want to get my care at Cleveland Clinic. You should want to get your care at Cleveland Clinic. I'm picking on them because they're sort of in my backyard, but I'm not really picking against, like, yeah, I would go there too. And I have, and I do. But I don't want to pay their full price. I don't want to do that anywhere.
Or their MRI price.
Yeah. I don't do that anywhere.
The Center of Excellence types of programs, is that also something that you guys will do if it's a part of the plan through Ben Engage? Will you search out?
We do less of the searching because we don't really have to. There'll be a program already in there about, hey, you had this surgery, or you're about to have the surgery. Here's where the places you can go. And if you go there, there'll be no deductible. Most of your out of pocket is waived. Here are your options, and it's the Centers of Excellence. And so either I've built it or another advisor has built it. Say, here's your Centers of Excellence network. So we'll happily send you to Mayo Clinic to have that transplant or to get a second opinion on your cancer treatment. That's what we should do.
It's interesting going back to what we were talking about earlier with the blue collar employers being kind of at the vanguard of some of this stuff and there being some disruption. It does strike me that there are ways to do a lot of these things with a carrot and not a stick that will save, I don't know, 10% instead of 25 or 30%.
Mm-hmm.
But this like zero deductible, zero copay within the regulations of high deductible health plans and all that, it's such a big deal. And it feels untapped. I know there's some providers that are doing this stuff. Garner Health is a really cool one I've heard a lot
Mm-hmm.
about and we've seen. But like, I think when you have plans set up with that kind of option, it applies to anyone. Like it should apply to a law firm and a bank. Like if your health plan is still a PPO, but you've got the zero cost option, half the people will take that if they're guided appropriately, if they understand, if they see quality.
Yeah. We've also seen if you put those incentives in, and some people, turn their nose up at it, like, just give me the plan with the logo on it. I don't, doesn't really matter. You see over the years, you see more people navigate to the lower cost plan that makes you jump through a couple of hoops, right? It has a couple speed bumps to make you do some stuff. Maybe you can't get your Cleveland Clinic MRI. You got to go across the street. But by the way, you're still getting that transplant at Cleveland Clinic. You're still getting the big stuff done there. You still want their expertise. People navigate to those plans. Like, oh, by the way, if you do it this way, you'll get your deductible waived, and their premiums just go down and down and down. They navigate. They self-select into those plans over time. It absolutely happens. I've seen it happen a dozen times. We can get there. We shouldn't force people to do it anyway. They'll do it on their own. They'll get it.
Well, before we drop, any last thoughts that you have about where this all goes? Like, are there gaps that you see that you wish can be better filled, or are there opportunities out there that you're like, man, I think we as an industry are going to be successful if we're able to do this one thing better in 5 years than we do today?
What employers are looking for are trusted advisors who are very transparent about how they do their work. And I think it's on us to be more open, be more public about how we do our work and our successes. And employers are going to want to find us. They want to do this work, but they got to be able to find us. And they have to, when they look us up, it can't feel like we're doing this out of a garage. Like that doesn't, whether we're good at it or not, it doesn't create the same level of trust that their big, huge traditional broker with 3 floors on a high rise with 300 employees has. They know they don't really want that, but they also need to trust. And so I think our industry that's niche now needs to grow up, collaborate better, have more resources to make sure that when these employers do knock on our door, that we've got this thing pretty well buttoned up, and help them understand not only will you save money and these will be better plans, but we'll be able to give you good service, compliance, and all the bells and whistles that you expect are going to be good. And I think some of us still struggle with that stuff as entrepreneurs and going out on our own and hanging a shingle and, having smaller books of business, that's, we got to keep evolving. But I see advisors doing a fantastic job with this. It's just, we're just early. We're still pioneers in this. So that's what I'm hoping will continue to happen. And I think if we continue to do that, then employers will come knocking on our doors, and we'll help this movement really take off.
Awesome. Well, thank you, Aaron. This was a ton of fun.
Yeah, it is fun to talk about. Thanks for having me. Appreciate it.
Thanks for listening to Healthy Savings by Milu Health. If you would like more information about any of the topics you have heard today, we would love for you to get in contact with us. Find us on the web at miluhealth.com.